Hello, and thanks for tuning in to STL TV. I'm Andy Ruzicka. Thanks for joining me and the City of St. Louis Department of Health for our healthy lifestyle discussion today about stress management for men. Today's conversation is a continuation of the Department of Health's Men's Health Series. The goal of the series is to help raise awareness about the importance of preventive health efforts for men in our community. Health insurance, a trusted primary care physician, and a completed annual physical exam are all essential to preventive health care and better health outcomes for men. Joining us today is Mr. Jerry Cotton. Would you please tell us about your background?
Yes, sir. As he stated before, my name is Jerry Cotton. I'm a licensed professional counselor here in the state of Missouri. I'm also an ordained pastor and have a private practice offering all types of clinical and spiritual therapy here in Clayton, Missouri.
That's great. And we also have with us Mr. Roy Butler. And can you tell me a bit about your background?
Yes, as you said, my name is Roy Butler. I am a facilitator for Family and Father Support Center, where we help gentlemen and men with family issues regarding family courts. We have an employment team to give them careers. We just help them establish themselves in everyday life.
And last but certainly not least, we have Program Manager Bobby Williams from the Bureau of Women, Children, and Adolescent Health at the City of St. Louis Department of Health. And of course, you can tell us about you too.
Well, so as you already stated, and I appreciate the warm introduction, our main concern, I work on our men's health program at the City of St. Louis Department of Health. Our main concern are those three things which were before mentioned. We want all men to have health insurance. We want all men to have a trusted primary care physician, and we want all men to complete an annual physical preventive exam so that we can improve men's health overall in our area, in our community.
So let's get right down to it. Let's get to our discussion here with just a couple of general questions about stress. What is stress and how to identify it? Now, I have heard that stress comes and goes, and for some people, it may linger. And I bet there are men out there experiencing stress and they don't know exactly what's causing their bodies, minds, and emotions to act the way they are. So, Mr. Cotton, we'll just start with you. Can you define, what would you say, what is stress?
Well, here at This Too Shall Pass here at the practice, stress is really about self-regulation. At times we think life is dealing with stress with different events that come, but really stress is connected to you being able to identify, manage, and communicate your emotions. Now, when life circumstances happen, sometimes they can be long, which it could be considered as chronic stress, or somewhat acute, which could be short stress. So now we're dealing with time and self-regulation, okay? So we're dealing with what comes and how long it's there, but then your ability to manage, identify, and communicate your emotions. This is how people become stressed, when they have challenges and difficulty communicating what they feel. I typically tell individuals, I use an acronym, soul food. So when you're dealing with stress, what is the soul food that you're feeding yourself? The S in soul food stands for source. So now we're dealing with time, and we're dealing with the management of your emotions. So who is your source? Where do you lean upon that's outside of you? This is directly related to the management of your stress. For some people, it may be a parent. For others, it might be a hobby. For a lot of us, it might be who we believe in or what we believe in. But what is your source?
And when you're talking about recognizing it, and you were talking about trying to verbalize it, for some men that don't understand what they're seeing, how do you recognize the signs of stress?
One of the quickest ways to recognize stress, whether it's acute or chronic, is when you are wrestling internally or externally with items of your life. So internally, if you're wrestling with, let's say, thoughts and cognitions and feelings. Externally, if there's a bill that needs to be paid and something is coming, you're wrestling with trying to figure out. So when there's a wrestling within your mind and your emotions, that's how you know stress is prevalent, which also leads me to the second and third letter of soul food, the O and the U. So when you're recognizing that you're in distress, O stands for openness, U stands for understanding. So it's important to be open and vulnerable about the signs of your distress. It's also important to have an acceptance or an understanding of what's going on. This will help to manage the distress levels that come.
Mr. Cotton, can I add into that? I think that is so great that you have presented that acronym for our viewers today. And you know, some of those signs also will include feelings of fear, anger, sadness, worried, numbness, frustration. Some people may experience a change in their appetite. Some people may have difficulty making decisions, sleeping. There may be some physical changes in a person's body, or as you said earlier, their chronic or acute health, or they may even turn to supplemental or supplements like tobacco use or alcohol use to deal with that stress as well.
And one more question for you, Mr. Cotton, or many more after this, of course, but are there any other signs of stress that people should be aware of?
You know, the human body is amazing. We are biochemically created to adapt. So the different signs, the way that you'll be able to determine is in when there's an imbalance. When there's an imbalance in you physically, Mr. Williams mentioned gaining weight, okay? When there's an imbalance with you mentally, how about your ability to stay on task or to concentrate? Or how about if there's an imbalance in your emotions? You all of a sudden get an overwhelming feeling of anger, or overwhelming, as Mr. Bobby mentioned, fear. So really, if you can point out and picture any areas in your life where you're imbalanced at, you are predisposed to experience some levels of stress.
So knowing what stress is and being able to recognize it can help manage stress and prevent it from getting out of control. How might stress impact a man's health, Mr. Cotton?
Oh, like I said, the body will manifest itself in a myriad of ways when dealing with stress. Physically, it can literally be headaches, hair falling out. It could be the bags under the eyes. These are just regular, normal day things, but are actually pointing to you being able to handle stress emotionally. It means that you won't be able to regulate your emotions. In other words, you may be dealing with a situation where you'll stay angry a lot longer than what you would typically do, or you would feel confused a lot longer than what you typically would do. And then obviously mentally, the way it poses on that, anywhere from your level of concentration to tangential thinking, also to the inability to just flat be at peace. So you can see different ways that stress can affect your health.
So COVID-19 has created fear and anger, sadness, worry, frustration, and uncertainty, resulting in a lot of unhealthy levels of stress. Can we talk about the need during a disaster, like the one we're currently going through, this pandemic, how to take care of our bodies, to connect with others, avoiding too much exposure to the bad news and the raising rates, and seeking help from some of our professional counselors? So let's move to you, Mr. Butler. Would you like to start off and tell us your kind of take on all that?
Yes, we do have to find new ways to express ourselves during the pandemic. Not being around people as normal, having to call them, text them. I went through a lot of stress, especially taking care of my wife during the pandemic. And I want to make one point too. Stress can lead to depression. I found myself being overwhelmed a lot. And I ended up being depressed during the pandemic earlier last year. But what I found that helped me a great deal was expressing myself, finding somebody to talk to, and meditation has really done a great job. I start that off every morning, and I try to get at least 15 minutes in, and sometimes it turns out to be only 5. But I have found that meditation and finding some ways other than being in front of somebody all the time to express myself has helped me a great deal through my stress. Taking care of somebody, having to do most of the things around the house now, it was overwhelming. And sometimes, I just broke down because because I didn't want to express to my wife what I was dealing with, because that would cause maybe more health issues with her dealing with heart issue. But what I found is, like I said, meditation has, everybody should try it. If you're feeling overwhelmed, just take your time and just try to be at peace in your mind. If it's music, find that music that you can connect with. Mine's just native flute music. And it has done a great job for me, especially overcoming my depression.
Mr. Butler, that is so encouraging to hear all that you just shared. I mean, the American Psychology Association in their Stress in America 2021 survey, they mentioned that we are definitely facing a national mental crisis that could yield serious health outcomes for years to come. And then as we're focused on men today, we know that men are less likely to report having mental concerns and dealing with stress. I mean, that was also recorded in that Stress in America survey 2021. Men are less likely to report it, but we're more likely to have behavioral and physical changes because of it, like what Mr. Cotton eloquently described earlier. So there's no doubt that the pandemic has definitely had an impact on society and specifically on men. 75% of people that took the Stress in America 2021 survey stated that they could have used more emotional support in dealing with the pandemic. And I'm sure a good large portion of that was men. We know that men traditionally do not reach out when they're in need of physical or mental health. So that's why it's so important that we're having this discussion today. And I thank you for sharing your experience with that.
Hey, Mr. Butler, I had a question about sometimes we don't know what we're going through while we're going through it. Did it take you a long time to recognize your stress and then going into the depression before you finally took action?
Yes, it did. Because us as men think we can handle anything, right? We don't want to give in to situations because we are men. We wasn't raised that way. At least I wasn't. So it did take a long time for me to actually cave in, to realize that I am overwhelmed. Maybe I do need to express myself. Maybe I do need some help. Maybe I need to readdress some things a different way. But when the depression had hit, I didn't talk about it as much, but luckily, Father and Family Support Center has therapists on staff. So, I did reach out to one and I talked to him at least once a week. And all of that helped, the meditation, using the therapist at work. We just got to realize, especially as men, I think we have that problem, as Mr. Williams stated. We have a problem reaching out to people when we need to. And we got to realize that no man's an island. We're not alone. And it's okay to ask. It doesn't mean that you're not independent because you ask for some help. That's what makes us whole. That's what helps us stay as independent as we can be. But there are some times that we need to reach out, and sometimes we don't because, we afraid to or don't want nobody to know our business or whatever the case is. But we need to learn how to talk to people and know that we're not by ourselves.
Thank you so much for that. Let's move to you, Bobby. And we know that stress in men is a major public health concern. Do you have some tips for how men can deal with stress?
Well, definitely like what Mr. Butler said, and also Mr. Cotton, as our subject matter expert, he alluded to this earlier, and he's so spot on. It's really going to be dependent upon the individual. You have to cater what works best for you. Mr. Butler talked about his meditation that he does in the morning or listen to meditation music. We also know that taking deep breaths, stretching, that helps. Having a healthy diet, regular exercise. Mr. Cotton also mentioned sleep deprivation, so getting enough sleep, that also helps to combat with stress. And also we know that there are preventive measures of making sure that we're adhering once again to that annual physical exam or other screenings or doctor's appointments that we need to take advantage of to improve our overall health. These are all things that one can do to improve the stress that they're facing in their lives. Mr. Cotton, do you have any additional measures you'd like to recommend?
You guys have hit on a whole lot of very good measures. I think it's very important that individuals understand that knowing, just like I said with soul food, knowing your source. What are your core beliefs? What are your core values? What do you really depend upon? And then the L of soul food, the last word is love. When we are able to understand one, as Mr. Bobby had mentioned, that we are loved. And as men, it's difficult to receive that love. Love is what allows us to be able to act out what are the best interests for not only ourselves, but for the people around us. And so finding that love is found, as it was mentioned, through meditation. Finding that love is found in taking some time, some peaceful time. So making sure that we know what our core values and beliefs are and loving will allow us to access and utilize the other things more efficiently, such as going out, doing meditation, such as taking care of our medication, such as giving to other people. It's really having a centered belief about who you are and whose you are.
Well, thank you so much for joining us to discuss these important topics focused on stress management for men. Please look for the next program in the City of St. Louis Department of Health's Men's Health Series as the department works to increase awareness about the importance of preventive health efforts for men in our community. Now, remember, health insurance, a trusted primary care physician, and a complete annual physical exam are all essential aspects of achieving healthy lifestyles and better health outcomes. Now, Bobby, let's turn to you. Where can our viewers find more information about stress management for men and overall preventive health care for men?
Thank you for asking that question. We want to keep it very simple for our viewers. You can call me at 314-657-1475. Again, that's 314-657-1475. We work with several community organizations that provide healthcare navigation for both mental and physical health. Also, Mr. Cotter, we know that unfortunately, African Americans are disproportionately impacted by mental health needs. Sometimes it helps to have someone that looks like them in order to talk with them and open up. Would you please provide your contact information for individuals that may be interested in this Too Shall Pass services?
Sure. I'm a licensed professional counselor, again, as it's stated here in Missouri, an ordained pastor, and they can go to my website at thistooshallpass.info if they have any concerns with managing stress, but overall managing life. And all of my contact information is on there. And from there, we can get contacted.
And Mr. Butler, could you share any contact information?
Yes. Again, I work for a Fathers and Family Support Center. We're located on 1601 Olive Street, downtown. The phone number is 314-333-4170. If anyone out there that need any help with family court employment, please give us a call.
And Bobby, just a really quick question to you. Earlier, you had mentioned about men and the stress management and not making men feel like victims. Can you elaborate on that really quick?
Yes, thank you for bringing that up. So that was the whole, that was the entire inspiration around the Men's Health Series. We know that men are disproportionately impacted by various health outcomes than women. We want to make sure that we're being sensitive to that, even in sharing and informing the public about that. We're not blaming men. Men are not the villain in this, but we want to ensure that men are empowered to take control of their preventive and interventive health and seek out the services and help that they need to address things such as today's topic, stress. So that is our intention, right? Because we don't want men to feel beat down. We get enough of that in society, but we want to encourage men. We want to strengthen and enable men to take a proactive step in improving their preventive and interventive health.
Well, thank you so much to everyone on our call today. And thanks for joining us. Again, that number for the Department of Health is 314-657-1475. You can also visit the City of St. Louis Department of Health's website at stlouis-mo.gov/health. For STL TV, I'm Andy Ruzicka. Thanks for watching.